I'm here this morning with Dr. Neeraj Narula from McMaster University, Canada. We're here to discuss the value of clinical trial data sharing and specifically what we've learned about advances in the treatment of Crohn's disease. Vivli is a data sharing platform where researchers can find, request, and access participant-level data from completed clinical trials for reanalysis or to ask and answer new questions. Dr. Narula, thanks for joining us today.
My pleasure.
Can you tell us how you heard about Vivli and what specifically were you able to do with Vivli that you couldn't otherwise?
I heard about Bibli from a colleague who had recommended that we could use it to access data from a clinical trial that was sponsored by Takeda. And Bibli really did allow us to access reliable clinical trial data to answer important questions related to the use of patient symptoms, biomarkers, endoscopy, and histology in inflammatory bowel diseases. I think data sharing platforms provide investigators with a unique option to conduct research without really having to take on the expense and the hassle of trying to collect on the data ourselves. I think data sharing platforms like Vivli are really great as they do provide granularity and transparency into clinical trials and the results they report, but also because they allow for investigators like myself to try and answer unanswered questions and really further the field of inflammatory bowel disease.
Great. Can you tell us a bit about the current state of management in Crohn's disease and what specific question you were addressing and how the data sharing that you accessed through Bibli was able to help?
Research in Crohn's disease is constantly evolving, and there are several new therapies that are very close to coming to the market. And as more therapies become available, we really need to decipher ways to determine which patients are likely to respond to what therapies. One way data sharing can help is allowing for interested investigators like myself to look for novel predictors for determining which patients will respond to which therapies. Fields like oncology have already moved to personalization of therapies, and it's really where the field of inflammatory bowel disease needs to move as well.
How can your findings be used in future clinical trials on Crohn's disease, and indeed also how can your findings be helpful in treating Crohn's patients?
I think clinical trial programs and eventually patients will stand to benefit from some of the research that we've conducted recently. We were able to put together a new endoscopic scoring tool for Crohn's disease using data that we collected from the data sharing platforms by looking at which endoscopic features actually had prognostic value with regards to their ability to heal, and modifying the existing and gold standard endoscopic scoring tool that we use, the SCS-CD score, by assigning weights for features and areas of the bowel that were tougher to heal. This modified multiplier of the SCS-CD study was published in Gut earlier in 2021, and I really think it will modify and adjust how we perform endoscopic scoring in Crohn's disease clinical trials moving forward.
Great, so you are able to use this finding to improve the way that we assess for Crohn's disease, and I'm sure that's going to be helpful to patients. Could you tell us, would you use the Vivli platform again? And are there other questions that you're thinking about in using Vivli?
Surely we will use it again, and we're actually just finishing up a study using data from the Varsity trial that we also obtained from Vivli. And in this study, we found that epithelial neutrophils can actually better predict response to therapy than any other symptom, biomarker, or even baseline endoscopic severity in patients with ulcerative colitis. And I think this finding will really help us to approach ulcerative colitis and perhaps design a similar type of tool as we did previously with Crohn's disease.
That's wonderful. Great. Well, thank you, Dr. Narula, for sharing your exciting work with us today and showing the value of clinical trial data sharing.
Thank you kindly.